Record. Hi, this is Hillary Heislope with the Clewiston Chamber of Commerce, and I am joined today virtually by Electa Waddell. Electa is the marketing coordinator for the Hendry Regional Medical Center Foundation. She also serves as the public information officer for Hendry Regional Medical Center, or the PIO is what we generally call it. So good morning,
Yes.
Electa.
Good morning. Thanks for having me.
Yes, absolutely. We're super excited. I reached out to Electa to see if the hospital might be interested in talking with us a little bit about face masks. I know a lot of our community members, business members have questions regarding face masks and what's truly necessary, what's best, what's kind of like the best management practice, if you will, as far as face masks are concerned. So I have a couple of questions for you, Electa. I won't keep you too long because I know at the hospital you guys are super swamped. But tell me first and foremost, tell me and those that are going to view this later, why should we be wearing face masks? What is the benefit there?
So I think the easiest way to explain it, and the way I explain it, is that I'm wearing a cloth face mask to protect you, and you're wearing a cloth face mask to protect me. So those
I like that.
Yeah. So those face masks, they're not going to keep the COVID-19 or germs in general from coming in to you. What it is doing is keeping your germs from going out. So as much as we can keep our germs to ourselves, we're not spreading our germs to others.
And that's great to know, because we are hearing now that people can be what they're calling asymptomatic.
Yes.
And you have no idea you're sick. I could be sick right now, even though I feel wonderful. I could be a COVID carrier.
Yes, and that's scary.
So you're going out and about and you don't realize that you may be potentially infected, if you will. I mean, I know it sounds dirty, but I don't know what other word to use. And I love that you talk with your hands, because you're going to see my hands a lot in this video. But anyway, so that makes a lot of sense, hearing this asymptomatic portion and now, saying I'm literally just protecting those around me from my germs.
Absolutely. You're keeping them to
yourself. And then I appreciate that they're doing the same for me.
Right. It's a courtesy. It's almost like, when we used to go up and shake hands, which we're not doing now. But
yeah, don't touch
that's
anybody.
A courtesy to you.
Yeah.
Is me wearing my face mask.
Right.
And so I hope when others see other people wearing them, it encourages them to do the same.
Absolutely. Absolutely. Now, what is a proper face mask? Like, what is proper face covering? What kind of material might be best for this?
So you can definitely use your household items. When we're talking about a face mask for the general public, that is going to be a cloth face mask covering. Okay.
Okay.
Let's say the Surgeon General just did a great one where he took an old t-shirt, he took 2 rubber bands. There's a video, I'm sure you can YouTube it.
I have on my notes here to post a link to the Surgeon General tutorial. Yeah.
So there's a bunch of ways, but the household items, really cotton and something that's double, triple layered will work fine. Take a scarf that you wrap around a couple of times will work.
What about like our being a fishing community, what about those like neck, I don't know the proper name for them.
I don't either.
I'm talking about that neck like sunshade thing.
Yeah, absolutely. I mean, the biggest thing is keeping your nose and your mouth covered.
Okay.
And, you want to make sure when you put a mask on that your sides are covered underneath. We want to keep all of this contained. So any covering that you have on that you're containing within here and to yourself is helping others.
Gotcha. Makes total sense. So there is no need then for the public to wear like medical grade masks. That's just
No,
not necessary at this point.
absolutely not. I have a few.
That would probably be counterproductive
here.
because there's such a shortage for you guys, you know?
There is. This is an example here. This is an N95. I feel like a stewardess.
Right?
This is an N95 medical grade mask. Okay. I took this from our materials department, and it will go back there so that our frontline workers have access to it.
Absolutely.
But these are for our healthcare workers. These are for our frontline people that are out there saving our lives, saving the lives of everyone in our community. Another thing about this is when you wear an N95, we have what's called a fit test. So just because you have one of these, if you're not, it's called a fit test. So if you're not wearing this properly, then it's doing you no good.
Gotcha.
So if you have to know how to wear it, and that's what our healthcare workers do. Also just the medical grade mask.
Okay.
These are things, I know they're readily available, but we're on shortage right now. So anytime that you're purchasing those, it's taking away from our frontline workers.
Right, from the frontline.
So we definitely recommend those cloth coverings.
Awesome. Okay. So what about children? Do children need to be wearing face masks? And, is that part of the CDC's recommendation, or the county, or Hendry Regional?
Right. So these are all recommendations, but we really are pushing for it. And yes, if they're over 2, they should be wearing a face mask. Obviously, you want to make sure that this is breathable, that your face mask is breathable, that it's covering your mouth and your nose, those kinds of things. Proper use is a big deal. But yes, children over the age of 2 is the recommendation.
Okay. And as far as wearing the face masks, I mean, let's say I go for a walk with my husband, or somebody else that's a part of my nuclear family, or I'm taking the dog out, or going for a bike ride, whatever. Do we need to be wearing them like that? Do we need to be wearing them in our homes?
So if you're going out, I take my kids on bike rides. I'm not wearing it then, but you should have one on you. So if you're coming up and you see that you're coming up on someone, of course, please still need to be keeping your 6 feet of distance. But I think the right thing to do is have a mask available. And if you're coming up on someone on your walk, go ahead and just put it on real quick.
Yeah.
Pass them and then take it off. I think it's really a courtesy to them. It's a courtesy to you, and our community as a whole.
Okay. And if someone is sick that lives in our home, what would be, you think, the best practice as far as the face mask goes? Like, let's say Rusty gets sick, or one of the boys, God forbid someone gets sick in your home. What are the recommendations there?
Definitely the sick person should be wearing the mask if they're going to be around someone else in the family. Let's say they're quarantined in their room, but they're going to come out, they need a water. They should definitely have the mask on, because we want to keep those germs to themselves.
Yeah.
Other than that, I think keeping your distance. I think that's still a big thing we need to remember. Just because you're wearing a mask, you still need to keep your distance.
Okay, that was one of my questions too. Do what?
I almost knocked over my iPad.
Oh, that's okay. That was one of my questions too, is the social distancing still, like a viable thing that we need to be practicing even with a mask?
Yeah, absolutely. Here at the hospital, we work really closely with the county, with partners like yourself here in the county. And the county put out a cute little slogan, and I thought it was really just a good way to remember it. And that's 6 feet of space and cover your face.
Oh, that is cute. I like that.
I think that's 2 things. Those are 2 really big things. If you're going outside of your home, if you're going into the public, that you keep your 6 feet of space and you cover your face.
Yep. I like that. So things like the grocery store, the pharmacy, currently we're only able to access essential businesses per, the governor's emergency order. All non-essential businesses were to close. But we definitely then want to be pushing the message to the public that we need to be wearing our face masks and keeping 6 feet of space and covering your face. If and when you need to leave your home to go to, to access one of these essential services that you might need.
Right. And I mean, we should still be staying at home. If you are not an essential worker, or you are not going out to get something that essential, like your groceries or your to the pharmacy, definitely stay home. I mean, I have a 3-year-old, and she doesn't understand what's going on, and she wants to see her best friend so badly. But we're staying home. And that's something that we all need to continue to do. It's very big. So
absolutely. What about going to the doctor? Maybe you had a standing appointment. You're not really ill. Maybe it's a yearly checkup, a yearly physical. You have to take your kids in for shots. Anytime you go into a doctor's office, should you be wearing a face mask?
Absolutely. Here at Hendry Regional, probably about last week, I want to say, we are now requiring anyone that enters Hendry Regional, that includes our clinics, our PT buildings, any facility of ours, you are required to have a mask, and we are no longer providing those masks. So you have to have a face covering, even if that's your t-shirt or something like that. But you do have to have a face covering when you enter the facility, and you have to keep it on the whole time, unless obviously the physician directs you to remove it. But we are not providing those anymore. We had been providing them, but as part of making sure that our health care workers have that personal protection equipment, those vital PPE, we are no longer providing those. But there is something we started just this past couple days, and that's our telehealth visits.
Oh, nice. So, I got that press release yesterday. Awesome.
So you can be in your PJs from the comfort of your couch, and it's
kind of like this.
There you go.
People are going to see my Zoom videos and be like, does that woman ever leave that spot? Because this is my home office right here.
There you go.
We got school going on over there and school going on over here,
thankfully I have my own office too.
And it's a consistent background to work with.
There you go. There you go.
So is there a correct way, Electa, that you can demonstrate for us on wearing a face mask?
Yeah, I'm going to pull my hair back just so that you can see my ears.
Okay.
Don't judge.
Oh, please.
Don't judge my hairstyle.
My fancy look.
That.
You're fine.
Okay. Here's the biggest thing. You want to clean your hands before you put on your mask and before you take it off. So I'm going to use my Purell. If you can wash your hands with soap and water, wash for 20 seconds. We're going to put it on. My lovely mother made myself and a few colleagues this cloth face mask. So it has 2 rubber bands. So I'm going to put it on around both ears. I'm going to pull down so that it protects and closes up all of this area. I have a nose piece, so I can actually squeeze mine closed.
Okay.
See that there. Some don't. If you have a cloth covering that doesn't, that's okay. And I'm making sure that my sides are flat. Okay, so what I'm trying to do is just keep everything contained within here.
Gotcha.
This is not, you don't want to touch this. Just like we try to make you not touch your face with your hands. You don't want to be touching this part once you put it on. Okay, because you're going to go out, you're going to go shopping, and now your hands are dirty.
Yeah.
That's called cross-contamination. So I'm finished with everything I'm doing. I'm going to go ahead and before I take off my mask, I'm going to clean my hands. And I'm not going to touch this part of the mask. I'm just going to touch the part that's around my ears and take it off. And I want to wash it now.
Oh,
because now it's been exposed.
Every single time we use it.
Yeah. You have to remember, that, you know, you've now exposed it to your germs. So you don't want to put it down. And because whatever it touches now, it has germs on it.
It's on there, yeah.
So if you're able, go ahead and
toss that in the wash.
Throw it in the washer and wash it up.
Gotcha. Okay, so I had a friend who made face masks.
Ooh, so nice.
I have this.
It's like a new fashion accessory.
I know. Well, that's a whole nother like little piece to this is people feel silly. They feel like people are looking at them going, oh my gosh, you're overreacting, you're too much. But, you know.
And they're not comfortable. Let's be honest, it's not comfortable to breathe through something.
It's not, and it might hurt your ears a little. But, I mean, if it can help keep me safe and make sure that I'm not bringing things into my home that are going to make those that are most important to me sick, you know.
Here's my favorite way people wear this. Ready?
Yeah. Yeah, I've seen that in Walmart.
This does nothing. Right? You've seen it out, Mom. You have to cover your nose and your mouth.
Yeah.
This does nothing for anyone.
Yeah.
You're still breathing it all in.
Okay,
and sharing it with everyone else.
I'm going to give this a try.
Okay, you do it.
Tell me if you
washed your hands before, right?
Yeah, well, so I'm just going to like pretend because I don't have hand sanitizer right here, but like I keep my hands. I grab only my rubber bands and then I want to put it on like so. And you said pull it down so that it's nice. And I hope they can still hear us. I don't have a nose piece, but
I can hear you.
It's pretty.
No, you don't, but that's okay. So you want to keep it up a little higher then.
Okay.
You know,
you
don't want it down by the tip of your nose. You want it up. So you're trying to make a nice fit.
Yep. And it kind of goes down into the chin. So
did I do good?
Do I look cool?
You do.
I look very cool. This is trendy. I'm going to be trending. So then I would grab just the earpieces and take it off.
Right.
Ladies, like the high point is you only have to do makeup from like here up. Just saying.
And no one knows if you're smiling or not.
Right. Well, no, you smile with your eyes. So
that's true. That's true.
So is there anything else that you guys there at Hendry Regional want the general public to know, whether it's, you know, just in regards to COVID-19 in general, regarding face masks, like what, is there anything more that we can do as the community to help you guys, you know, better be able to do your jobs and handle the influx of demand?
Sure. Well, first of all, I want to say thank you to our community, both here in Clewiston and LaBelle. The outpouring of love and support. I can't even put it into words how appreciative we are, our frontline staff, all of our staff are, for the community to come together. And so that's the first thing I definitely want to say. And no, we're amazing place to live, amazing place to work here at Hendry Regional, and thank you to all of you guys. I do want to say one thing. I think there's a fear about coming into the hospital, either into our emergency department or one of our clinics. And yes, we do want you to stay home if you're able. That's why we're offering those televisits through our Hendry Regional Convenient Care in LaBelle and the Forbes Center here. To reach those primary care physicians for those more minor things. But we're seeing patients coming in that are seriously ill that I think would have come in earlier. And it's almost like they're just waiting almost too late. And so really I want everyone to know, like, we're terminally cleaning here at the hospital, which we normally do, but we've even stepped it up higher than that.
Absolutely.
We also do what we call Take 5. We do it 3 times a day, and we come in and we take 5. Everyone takes 5, and they clean their area around them, those high-touch areas. So your computer, your phone, and I think that's something you should do at home. I mean, clean your doorknobs, clean your light switches, clean your phone. I mean, this thing is just dirty. it's filthy.
Yeah, I've
so
always heard that the phone
I
is
know, and you're always
big.
putting it by your face. So,
Right? It's like right there. Ugh.
yeah. So I think, you know, I want to make sure that people know we are here. We are doing everything we can to keep everyone safe. It does look a little scary when you come in now because we all have face masks on, and you know everyone's wearing their protective equipment. But that's what we're supposed to do because that protects you, and that protects our healthcare workers. And I think that's the biggest thing, biggest takeaway. So, you know, remember that the symptoms are fever, cough, shortness of breath. We do have tests available, and we have been doing a lot of tests. I know we've done over 200. We have had some COVID patients in. We also have our isolation unit. So we have everything that we need right now. And we've been able to work really well with our community and with the county to be able to get the needs that we need to serve. So we do ask that you call ahead. So if you think you have symptoms, or that you have the symptoms and you want to be tested, we ask that you call ahead, and we're able to walk you through that process to be able to keep everyone safe. So
Excellent. Well, and just in closing, kind of something that the chamber has put out, I believe one day last week, was protection or infection. You choose.
Yeah.
You know, and we don't mean that to sound scary. I mean, it is a little intimidating to go to the store and see here in the United States where people are wearing these face masks. And, you know, it's just not something that you really thought you would ever see here, you know.
No, but, you know, it may end up being our new norm.
Yep, exactly. Exactly. Yeah. As we move forward from this and, you know, the president, the governor, they, you know, your elected officials decide that it's time to start reopening gradually, whatever that process is going to look like, it's going to look different than we looked when we came into this. And it's important for people to know that. It's important for people to note that, you know, things might not be the same as they once were.
And they may not.
But we're humans. We adapt. We learn to work within this new normal. And I mean, we are excited for a day that we can go back to, you know, I don't know, going bowling or, you know, whatever it is that you want to go do. But we're going to get there, and we're going to get there soon, you know, fingers crossed.
And we're going to do it together. And we're going to do
Exactly.
it together. It takes every single one of us doing it together and working and adjusting to whatever that new normal is going to be.
Exactly.
So know that Hendry Regional's here for you. I appreciate you letting me join you this morning.
Absolutely. I was happy to have
virtually.
You. And I know. And know that as the Chamber of Commerce, we represent a multitude of businesses and industries in our area, and we are very grateful for Hendry Regional and all the work that they've been doing, your nurses, your doctors, your staff. You know, from the top to the bottom, it's been a constant stream of communication with the public, a constant stream of transparency. And I hear it, you know, just being connected to the business community. I hear the chatter where people are just very pleased with HRMC's response.
Thank you.
To this pandemic. So please share our appreciation to.
I will. I definitely will.
Thanks,
Thank you.
Have a great day.